Well, that'll wake you up, and good evening, everyone. I'm Dan Rivers, and I'm back again here, and I brought a guest with me this evening, and his name is Dr. Noah Erickson, and sort of new to the Youngstown area, but Pittsburgher, and now has a practice in Boardman, and innovative medicine is what we're really talking about, isn't it? And, as I was interviewing you prior to this, I said, man, you spent a lot of time in education, haven't you?
That's right, Dan, and I want to thank you for the opportunity to be here tonight. We're going to be talking about my practice, Innovative Family Wellness. I'm the clinic's founder and director. I've been in Boardman, Ohio now for 3 months after spending almost a decade in integrative medicine in Pittsburgh.
Now, you say integrative medicine, and people are going, what?
Yes.
Right?
It's the combination of traditional testing with ways of treatment that get to the underlying cause of the problem. In other words, we don't use a drug for every bug and a pill for every ill.
Right. And
we look for causes.
You studied acupuncture?
Yes, I'm a medical acupuncturist.
Okay, and chiropractic?
Yes, I'm a chiropractic physician.
Yep. And what other disciplines are you adept at here?
Yes, I have education and experience working as an athletic trainer and an emergency medicine technician.
Wow. We have a nice website, too, if you want to go to that, friends, and follow us along. And all you have to do is just do like we did. Go to Google and put in Innovative Family Wellness, or go to innovativefamilywellness.com. That'll get you there. Also, another way to get you there is just stop out. He has a practice in Youngstown, and it's right across from Preston Toyota in the vicinity of our township building out here. And his name is Dr. Noah Erickson. We're going to talk about some interesting things tonight, and I invite your phone calls at 729-9977 or 800-777-5700. And I had mentioned earlier that I have been treated with acupuncture for a shoulder injury, and I was very impressed with the results. And it is really a good discipline, but that's not all you do, because you treat children, and sometimes that's not the best for children, is it? I mean, well, they're squiggly.
That's right. Needles and children typically don't get along.
Yep.
So I have a unique program in Innovative Family Wellness called Dr. Noah's Ark, and that stands for Autism Recovery Center. And I use underlying metabolic, nutritional, and genetic predisposition and tests to follow up to look for the underlying causes.
Now, that seems like a very narrow focus when you're talking about autism. I've done some shows on autism, and I know it's really tough for the families, but how widespread is autism, and how many families do we have in this area that could benefit from what we're talking about?
The name is reflective of the widespread category. It's actually called Autism Spectrum Disorder. And that spectrum implies that you may have a child with ADD, attention deficit disorder.
Okay, I'm familiar with that. Yep.
Yes, ADHD, attention deficit hyperactivity disorder. And there's other conditions, lesser known, called PDD-NOS, and also Asperger's. And that's high-functioning autism.
Okay, so when you put it that way, now I know a lot more, right? I mean, because when you just say autism, I mean, well, I'm not sure, that's kind of a generic name. But when you put all those other names out there, it brings it home, doesn't it?
Indeed. And what's interesting about our practice and my program, Dr. Noah's Ark, is we treat each child with personalized nutrition. There's no two children alike. It's interesting. Many times when I treat twins, the parents will automatically assume that they'll have the underlying genetic factors or the environmental triggers, and it's often very common to find completely two different children on the spectrum.
Can you give me an example of how you treat children with diet? I mean, you're talking. That's what you just mentioned, and we can all relate to food.
Yes, indeed. Many of these children have underlying food allergies and sensitivities. We all think of the classic anaphylactic response where the throat is swollen, the eyes are watery, the sinuses congest. But these children often manifest behavioral problems. The food allergies leak across the membrane of their intestinal tract. It's called leaky gut syndrome. And they end up irritating the brain, causing neurological inflammation. And that's a pretty hot word. So we use omega-3 fatty acids, change of diet. Typically, gluten, casein, and soy are top among the list of allergies.
All right, listen, if you're finding this of interest, give us a call. And there's no charge here tonight, because you can get all this information free. And if you have a child out there that's having any of the maladies that Doctor has talked about, possibly just some food intervention could help, right? Avoiding or adding.
Food allergies and also food chemical additives, colorings, dyes, preservatives. They often trigger the brain to respond abnormally. So these are called neurotoxins. They're toxic to nerves. They cause nerves basically to burn out.
Okay. And you meant the colors, right? Is that food colors, dyes, is what you just touched
Indeed. Red dye number 40, blue dye number 2, there's yellow. And these dyes actually irritate the nerves in the brain and cause inflammation, almost analogous to somebody having a seizure where there's neurological inflammation, and sometimes the fever, the warm temperature of a child, goes along with that condition.
And now we're going to be jumping all over here tonight, and I don't want to limit this to children because there's a lot of grandparents out here. There's a lot of parents out here that have children, and they don't know what to do. But we're also talking about people that have problems as simple as GERD. Sounds simple, but it can be serious if left unchecked, can it?
Right, and that's something with adults. I'll use techniques like medical acupuncture. I'll use chiropractic manipulation to the area of the mid-back because those nerves actually control the sphincter that keeps the stomach closed, preventing acid coming up. And something also we find, this is working for children and adults, we eliminate Helicobacter pylori and other strains of harmful bacteria that create an irritant situation called dysbiosis. Basically, there's too much bad life and not enough good life in there, and you end up with GERD.
Well, you know what I'm hearing right now? I'm hearing, well, you know, my doctor does this. What do you bring to the table that's different? I guess that's a great question. Huh?
Sure. Rather than using a medication that would suppress stomach acid, say, for example, Prilosec or Nexium.
Been there.
Yes.
Maybe this morning.
What we do is we'll use selective acupuncture points that are known for restoring the stomach function, allowing for normal digestion. We'll use nutritional supplements to restore healthy bacteria, eliminate irritation. This condition often presents in people as a metallic-y taste in their mouth. They'll have burning. They'll wake up at night and needing to change position. Common food triggers are coffee, alcohol, spicy foods, tomatoes, and citrus.
So, I mean, you would still go along those same the protocol of limit your alcohol, limit your coffee, limit all, but sometimes that doesn't cut it, huh?
And that's where alternative medicine shines. The acupuncture, chiropractic, change of diet, and the nutritional supplements. For example, many people are familiar with eating yogurt because it has beneficial strains of good bacteria. Well, those bacteria can actually help negate the bad bacteria and prevent the reflux.
Well, that's totally different than Jamie Lee Curtis is talking about then, because she's talking about the probiotics in her good yogurt, right, and all this stuff. What are you saying, hogwash?
She's spot on. But the thing is, with the dairy allergies, we often find that that's one of the triggers for children. So the casein, in other words, the protein in the dairy component, and for my bodybuilder patients out there, they know about drinking whey protein and dairy protein to get big, strong muscles. But oftentimes, this causes the brain in a child to become irritated, and they exhibit autistic-like behavior.
All right, listen, you're hearing Dr. Noah Erickson here on our program, and we're welcoming him to Youngstown. I'd like to welcome him by some phone calls, so our lines are wide open. The show is free tonight. He's going to be up with us till game time here at 6:40. I told you 6:45, Doctor, but it's going to be 6:40 when we join the YSU game. But he's going to be here. We're at your service here, and he's new to the Youngstown area, but he has some innovative ideas, thus the name InnovativeFamilyWellness.com. So maybe you're exasperated with your treatment, and this is the place to start by giving us a call. And I want you to remember a couple of things. His website, easy to find, Innovative Wellness. You Google that, it's going to pop up first. Innovative Wellness, that's going to pop up. Or you can put it in and go to innovativewellness.com. You can read all about him. And he's at 8261 Market Street in Boardman. And you're here 3 months, and you're thinking, hey, I'm coming over here to Youngstown, Ohio, the good life over here. You've still got a family in Pittsburgh, right?
Yes, indeed, I do, and we'll be moving here shortly. So it's really interesting in this area that I've been finding there's higher rates of autism. There's also some higher rates of cancer. And what I'm striving to do right now is test children and adults using this biomedical approach and look for underlying causes. And it could be the low vitamin D level because the sunlight's not adequate here as it is in areas south of this area. So vitamin D deficiency is a major player for hormone imbalance, depression, autism, and also bone density problems with females.
Yeah, and get your vitamin D from the sunlight. That's the best way, isn't it?
That's right. We might be able to do it this weekend.
Yeah, we might be able to get a little bit of that. All right, listen, we're going to screen some calls here. Our phone number is 729-9977, 800-777-5700. All the information is free here. We'll go to calls in a moment. I'm Dan Rivers on 570 WKBN with Dr. Erickson. I got a couple quick notes here. And first of all, from one of my favorite topics, golf. All right, a couple calls dropped off, so we still have time for your call. We've got, let's take the calls that we have screened up here, first of all. Chang in Boardman on 570 WKBN. Hello, Chang.
I had a question, please.
Yes, Craig.
Going along with the traditional medical model, babies, brand newborns, and very young children are assaulted by the various regimes of vaccines that are required these days, and it's a terrible assault on the baby and the young child's brain and the immune system.
So, Craig, are you making the point that you shouldn't have your child immunized? Is that what you want to debate, or
no? I wanted to ask the doctor's opinion, what he feels about vaccines.
All right, let me stop there because we have a lot of calls, and I want to make sure I get that in. I'll come back to you again. Go ahead and expound on that, because a lot of autism seems to stem around, or people talk about the vaccines.
Yes, that's also been a very controversial topic. Most of that information, if we will, sort of hot topic, buzzword topic of vaccines comes around the fact of introducing allergens too prematurely to the body, because oftentimes the vaccines are grown on egg albumin. And the other area of interest and topic and discussion comes with the metals. Mercury and aluminum are called preservatives and adjuvants. In other words, they activate vaccines.
But to pin you down, I mean, does he have a point here? The vaccines are in doubt as to whether they should be given?
Well, I think there's always going to be that hot button topic to talk about. What I can say is when we test children, we do often find mercury, but there's other causes. Dental amalgams from the mother, believe it or not. Mercury in the fish, and aluminum can come from underarm antiperspirant. Aluminum can be in cookware and baking powder, so there's sources of heavy metal toxins and also underlying food allergies that trigger this. So this condition's multifactorial.
Craig, answer you, or you want to continue?
Very good, sir. Thank you very much.
All right, thank you very much. And I'm still not sure if you are for vaccination or not, though.
It's an individual choice. It has to be made by the parents in conjunction with their doctor.
Yeah. To me, my kids are vaccinated, and it just seems that it would be quite a step not to vaccinate them. I mean, from the knowledge that I had.
Yes, and the other area, too, that comes under question with this is could we perhaps delay the schedule? So I know there's some pediatricians in the area that I've met thus far, and they'll actually honor the parents' request to delay that schedule.
Okay, very good. All right, we're going to go to our next call. It's Mike in Youngstown. Our phone numbers are 729-9977, 800-777-5700. Don't forget, we're introducing you to a new doctor in town, and his name is Dr. Noah Erickson. He practices on Market Street in Boardman, right across from Preston Toyota. And his phone numbers are on his website, all that. You can call for the appointment. But tonight, it's free advice. So if you're out there and you have children that are afflicted, your passion is children, right? I mean, you have two of your own, but you love taking care of children.
That's right. I have two boys, 4 and 2, and the focus of my practice is using this nutraceutical approach for children with autism.
All right, very good. Let's continue, and we can help adults, too. Here is Mike. Hey, Mike.
Hi, how are you?
Hey, Mike, your turn.
Good. It's not a child question; it's an adult question. I have carpal tunnel, and it's just killing me. Is there an alternative than surgery? I go to the doctors, and they're saying, "Oh, you need surgery," and I can't do that. I don't have time.
Describe it a bit, if you will. A wrist, is that what it is?
Well, it's my hands that go numb. I work with my hands every day, and I mean, I work with wrenches and tools, but I'll drop the wrenches or bolts or whatever because I just can't feel them anymore.
Wow.
It keeps me up at night, stuff like that.
Sad.
Is there an alternative?
Sure. One thing to consider, caller, is a double crush syndrome. Oftentimes the nerves will be pinched not only in the wrist and the carpal tunnel. We'll have to do therapies like acupuncture, ultrasound, stretching exercises, and use anti-inflammatories like omega-3 fatty acids. There's also impingement in the neck. So there's two areas to look, and that is an area where alternative medicine shines in the fields of chiropractic, releasing the pressure off the nerve in the neck, acupuncture working on the wrist, and also nutrition for an anti-inflammatory approach, and also vitamins B12, folic acid, and B6.
You went right after this. I mean, this must be something that you've seen.
Yes, I've had several mechanics, and also another population prone to this is computer programmers and also cashiers constantly swiping items across that scanner. Repetitive motion creates the inflammation, so there's a conservative approach before you go under the knife.
Gotcha.
Oh, good.
Any advice here specifically for, now you say in the short run right now, you need to use your hands. You're a mechanic, right?
Right. Well, I work at an oil company, so I work with pumps and tanks and stuff like that.
Got it. So what type of treatment are we talking? How long and how aggressive would you be here, doctor?
Sure. Typically, classic physical therapy would be 3 times a week, anywhere from 3 to 4 weeks. And the advice, too, would be to wear a splint called a cock-up splint at night, which positions the wrist in a very non-pressuring manner for that nerve called the median nerve that's typically impinged.
Yeah. Hey, you know what? Give the guy a shot here, caller, and see if maybe he can help you. He's on Market Street across from Preston Toyota, and his website is innovativefamilywellness.com. And if you like what you see, make an appointment.
Great. Thanks a lot.
You're welcome. All right. Advice free tonight here, and we're on with Dr. Noah. And we're talking a little bit about all kinds of alternative medicine. His website is innovativefamilywellness.com, and our phone numbers are 729-997-800-777-5700. Let's go to Ron and then back to Darlene. Hey, Ron, can we help you?
Oh, God, I hope so, Dan. I think I either have A, a sciatic issue, or B, some kind of a lumbar 4 or 5 issue, but the main problem is my calf muscle feels like it's going to implode. It hurts really, really bad, and my right foot feels like it's always asleep. They're suggesting I get a epidural nerve block, but I'm really nervous about it, and I was just wondering if there's
Let me ask you a couple of questions.
alternative.
I've been there with you. Let me ask you a couple of questions here. How long have you had the leg almost falling asleep, almost a dead leg?
We're probably going on a good month and a half now.
Okay, so it's still fairly early, doctor. Go ahead.
Okay. May I ask you, do you still have control of your bowel and bladder function?
Yeah. I mean, there's a little bit of issue with the hardness of the bowel issue, but other than that, I'm not having any problems at all there.
And I assume you've had an X-ray or an MRI at this point?
I got the MRI done, and they're saying that there is something between the lumbar 4 and 5 that is showing, and but they're not, it's not 100%.
Okay. Sometimes this is called spondylosis. In other words, it's a little bit of arthritis. Are you in your 30s?
I wish.
Huh.
A little bit later, huh?
It's 50s, yeah.
50s. Okay, that's a good age.
Okay, great. So typically what this is and how I treat it in my practice is it's underlying pinched nerves, some malaligned vertebra. And here's when we use a combination of physical therapy, working on a muscle in the buttock called the piriformis muscle. It typically squoses on the sciatica nerve, and this is where medical acupuncture gets another shining star. We put needle points along a meridian called the bladder meridian, which is on the backside of your leg, and we have a therapy in chiropractic known as spinal traction and manipulation. So there's safe and effective ways to realign your spine, take the pressure off the nerve, and we use drugless nutritional prescriptions like glucosamine sulfate, chondroitin sulfate, MSM, hyaluronic acid, and the highly touted omega-3 fatty acids as a natural anti-inflammatory. So there is definitely health and hope in this field using alternatives.
So you're really, if I can jump in, you're trying to reach the same conclusion that maybe an epidural might do, where you're is calming that nerve down, but you're trying to do it conservatively. Is that true? That's
right. Many people don't want to go under that procedure, and this is where the integrative medicine techniques, where we look at the structure, almost like an engineer or an architect would consider the structure.
Right.
If there's a malalignment or malformity in the back, the muscles, the nerves, the ligaments, we look to solve the cause of the problem.
All right, no guarantees, but if you like what you see on the website, make an appointment, okay?
Thank you, guys. Appreciate it.
All right, very good. And again, I give that website. It's innovative, and I got to go back here, innovativefamilywellness.com. And I haven't really got a chance to delve into your website very much, but it is out there for you folks to go ahead. And you guys can get the phone numbers off there, or if you know someone with a computer, they can help you out. But in any case, go to their website or go on out to Market Street and just make an appointment in person if you like. And they're right across from Preston Toyota. Here's Darlene on 570 WKBN. Darlene, how can we help you tonight?
Hello, I'm a first-time caller.
Thank you. Me, first-time host here.
I had a question for Dr. Erickson.
Just talk directly to him.
Okay. Hello. I was just inquiring. I have a nephew who is autistic. He's now 4 years old, high-functioning. But at 3 months of age, he had botulism also. I was wondering if you can give me any insight on that at all.
Yes. Did you say botulism?
Yes.
Yes, typically what we do, we ask for a culture of the stool. And this is the gut-brain connection, what many people call leaky gut syndrome, where we have to realize that most of our serotonin and melatonin is actually made in our gut. So we'll often find mood swings, irritability, aggressiveness, and insomnia. So after a stool culture, we find that there's often too many bad bacteria in comparison to the good bacteria. So we start to rebuild the gut. We also use immune stimulators. There's powerful herbs and homeopathics that trigger the immune system to fight off underlying infection. So this is one area of research that's very hot in autism. It's called autistic enteritis. In other words, inflammation of the bowel of children where they do not make the proper brain chemicals.
Boy,
I know he has bowel issues still, even though he's 4 years old. I'm just that's very interesting.
How do you get so you put these children on a diet, which, are they receptive to this diet?
We should ask, are the siblings acceptable to the diet, right? Yeah. But yes, they are. What happens, we typically do remove gluten, which is a wheat protein. We remove casein, which is a dairy protein. So these diets are typically wheat, dairy, and soy-free. We also ask that there's no sugar in the diet, refined sugars, snack foods, popsicles, candy bars, ice cream, because the sugar feeds these underlying infections.
All right, now I'm scratching my head going, what do we eat?
We try to eat a more paleo diet, if you will, okay? A diet that's higher than fruits and vegetables, a diet that focuses more on protein, and we look at the foods to lower inflammation, like omega-3 fatty acids and fish.
Okay. So, you know what, when you talk about that diet, that'd probably be a good diet for most of us anyway, right?
And what's interesting, too, another food group is looking at the use of turkey. Turkey's high in 5-HTP, and many of these children have problems with mood swings and depression just like an adult would.
Calm down.
And that's that old turkey thing at Thanksgiving where someone all of a sudden becomes very calm and wants to relax and rest.
Darlene, do you have a follow-up or anything we can help you with?
No, that was very informative. I appreciate that very much.
All right, if you want to look at his website, it's integrativefamilywellness.com. All the information will be there for you at your beck and call.
Okay, thank you very much.
Nice to talk to you. Thank you for being a first-time caller. Jay, if you will hang on in Columbiana, I'll get to you in a second. We have another 10 minutes in the program. We have a short news update, and we'll take more of your phone calls in rapid fire as we continue right up to YSU basketball time. And our guest here is probably a Pittsburgh Steelers fan, but we welcome him anyway. And you're eventually going to move the family down and everything and make this your home?
Yes, we are. And go Steelers.
Oh, there you go. All right, well, we got the Brownies, and we're coming back. But Dr. Noah Erickson, new to the area, and he's bringing some information out here that I am somewhat familiar with. Number one, the acupuncture. I understand how powerful that can be. Chiropractic can be very beneficial. And diet, that diet is probably about 90% of it.
And that's it. When I typically see a new patient, we look at dietary triggers. We first try to clean up the diet, get out the allergies, lower the sugar content, and look at a more balanced, healthy diet.
All right, we'll have more on this in a moment. Again, the website, integrativefamilywellness.com. Dr. Erickson with us till 6:40, YSU time at that time. We still have time for your call. Jay, you'll be next when we come back. Nice to meet the acquaintance of Dr. Noah Webster here on 570. Did I say that? You knew that was going to happen, didn't you? I was kidding. Dr. Noah Erickson is here, and I believe it's Jay in Columbiana, our next call here. Jay, welcome. Good afternoon. How are you?
Hi, I'm well, thank you.
Thank you. You're with the doctor. Please go ahead.
I'm calling because I was curious. I would like to take a multivitamin, and anyone I've ever tried has given me really bad headaches, like migraine kind of headache.
Wow, is that common? Does that happen?
It can be binders, preservatives, and fillers. However, when we look at my science called epigenetics, why do some people need specific types of folic acid and B12? Not only does this hit the autism hot topic button, this also hits people when they take a B vitamin. Heart palpitations, insomnia, nervousness, jitteriness, and this is classically where we shine in personalized medicine, looking at the underlying types of nutrients that your body specifically needs to make it function correctly.
Oh, that's interesting. Jay, anything that trigger you? What do you think about that?
So really you're saying just any multivitamin is probably not going to work for me?
Well, two things. You may be using an inferior quality vitamin, and it's possible that a synthetic form typically of the B vitamins, when you look at a multi, which has A, D, E, and K, the fat solubles, it also has antioxidants and minerals, but typically when a patient complains of the symptomatology which you suggest, it's attributable to the B vitamins. There's 5 types of B12, and in fact, for autism, there's something called methyl B12. Many children do famously with it. They begin to speak. They're able to walk, go back in mainstream in school. However, other people end up with palpitations, and folic acid ends up being a neurotoxin. It's a polyglutamate.
Now,
so we have to look at that.
Excuse me, but I'm thinking maybe she might want to go to the portion on your website for genetic testing. Is that correct?
Indeed. That's generally where I find the answers to these problems.
All right.
Okay.
Check that out. To genetic testing, if you like what you see, give him a call.
All right, thank you.
You're welcome. Glad to help you. Let's go to Jim in Poland for Dr. Erickson. Hi, Jim.
Hey, how you doing?
Hey, Jim. Here to help.
I had a quick question for you. Do I need a referral to your office for my family doctor, and do you guys take CareSource?
No, you don't need a referral. And what we do with regard to insurance, and this is for everybody, we give you a receipt where you self-submit to the insurance company. Right now, unfortunately, insurance is not reimbursing great for acupuncture and nutritional services, so these alternative medicine services, hopefully, in the near future, will be considered. The good news is they're actually using battlefield acupuncture now in the United States Air Force. They're training their physicians to be trained in acupuncture for phantom limb pain. They're also looking at the science of chiropractic. There's now chiropractors in the Army, the Navy, serving our men and women, so we're coming around.
Great, fantastic. Thank you.
All right, very good. But the quick question, and I remember that too, because acupuncture is either cash or you can try to get it back from your insurance company. That's just you're kind of on your own, but it's pretty effective. Pretty effective, and it's gaining ground all the time.
Yes, it is. In fact, you know who's really doing great justice for this? Dr. Oz. Many people know Dr. Oz. He's brought in livelihood to this topic of health. It's no longer I'm scared to get a colonoscopy or I'm scared to get a checkup. He's talking about those omega-3 fatty acids, vitamin D deficiency, so he's helping us a lot.
All right, what would you say that you haven't covered tonight? You've done a great job, but what would you say that you haven't covered?
For men and women, fibromyalgia and chronic fatigue syndrome. To sum that one up, it's often a cause of underlying hormonal imbalance, nutritional deficiency, adrenal fatigue, food allergy, and toxic metal syndrome.
All right, very good. Well, I tell you what, there's a lot of words I've learned tonight here, but fibromyalgia, and I said to you that is just kind of a chronic pain. Is that how you describe that?
Yes, it's a condition characterized by a series of sensitive points along the back and the extremities.
All right.
Classically associated with magnesium deficiency.
Let me give the phone number out here for people who do not have a computer. If you'll get a piece of paper and jot this down. First of all, Dr. Erickson is at 8261 Market Street in Boardman. The landmark is Preston Toyota. You know where that is. And if you'd like to call, 726-3458. 726-3458. And I'm also going to give you a toll-free number for those of you listening in Western Pennsylvania and out of our area, 877-298-6300. Well, 877-298-6300. Until we meet again.
Dan, I want to thank you. It's been wonderful, and I look forward to joining you again.
Very good. Dr. Erickson doing a great job here on the program. I hope he can help you. And, of course, go Penguins.